I am Dr. Shamli Upsa, Chief Medical Officer, and I would like to call this press conference to order. We have in our midst Honorable Minister Dr. George Norton, who will make some opening remarks, and then we'll open the floor for some questions. So I'll pass on to the Minister now, who will make his statement.
It is all about the new system for the procurement of drugs and medical supplies. And this is because, as you would have heard yourself, a topic of prolonged discussion in the presentations at the recent budget debate, especially from members of the opposition. And I take this opportunity to just clear the air on certain aspects of their presentation. Permit me to explain the process for the procurement of drugs and medical supplies as presented in the Ministry of Public Health Program 4, Regional Health Services and Regional Health Program budgets. The procurement of drugs and medical supplies remains substantially a centralized process, with the exception of minor purchases that include medical gases, snakebite kits, and small emergency supplies. The allocation have been distributed across the regions as a first step in improving the program budgeting of health costs at a regional level, even as work is advancing on a costing exercise to determine the total cost of drugs expended in each region to address the disease profile of that particular region. Procedurally, the monies will be warranted back to the Ministry of Public Health from the regions, as was in the case last year. You must have heard about the 700 million that was warranted back to facilitate centralized procurement and the benefits of economies of scale and requisite quality controls. This means that the regional executive officers will send the agreed sum to the Ministry of Public Health, and the Ministry of Public Health will pool all these monies and purchase drugs and medical for the facilities across the region. I trust that this clarifies for all and answers all the related questions for drug and medical supplies as they pertain to regional health programs in the 10 regions. Importantly, let me add that the drug supply system is far from perfect, and to date, there has been no administration that has had a situation free from shortages of drugs and medical supplies in some parts of the country. This administration is taking steps to strengthen the management of the drug supply chain, and a detailed review of all aspects from procurement to distribution to consumption is being undertaken. This government will ensure adequate drugs and medical supplies are provided in all of our facilities across the country. We are not there yet, but we intend to get there soon and fully resolve these issues well within our first term of office. What we can guarantee you, the system that persisted before since 2005 of sole sourcing is a thing of the past, and we have now a new bidding document where new companies or companies that have never participated in this open competitive bidding will have a chance to take part in this exercise. And even with the present bidding document, there are some changes to be made. We are definitely moving away from brand names and going for genetic names. The different numbers of medical supplies and pharmaceuticals are separated together in lots. So we find that, for instance, if we need diabetical supplies, then that will be in one lot. If we need ophthalmological supplies, that will be, and pharmaceuticals, that would be in another lot. And whoever is participating can bid for a particular lot. We made some changes where in the bidding document it was stated that you had to bid for 100% of the lot, meaning everything. Changes are being made with respect to that. Changes are also being made to where tablets, for instance, were asked to be provided in bottles, and we know the newer system and the more effective system of the blister packages are much more used today, so we are making changes to that. As well as some of the requirements, like for instance, some of the requirements saying that the suppliers or the procurer should have lab facilities to test these medications, and that they should state for the last 3 years the major sources of drugs that they've supplied, as well as the ability to supply these medications. Adjustments are being made in that respect, and the public will be made known of that. All in all, as I said before, we haven't been, let's say, perfect. We intend to, however, get this system in place so that each region will make efforts to acquire the medications that they need in any particular region. That is as far as the new system for the procurement of drugs and medical supplies are concerned. This press conference also was called to bring you an update of the status of the Zika virus, which I imagine all of us in Guyana have a keen interest, especially since we learned that Brazil only recently have mobilized 220,000 of their armed forces to fight against the Zika virus. And we understand in neighboring Suriname, it is wreaking havoc. We had the big discussion in Parliament whereby physicians claim that they are diagnosing this disease by the symptoms that they're seeing in patients. Of course, technically speaking, we can only say that a person suffers from the Zika virus after doing that laboratory test, which is done in Trinidad and Tobago, CARPHA. We have so far sent out 88 samples for testing, of which we received. Our last batch we received was on Friday evening. And unfortunately, one was positive. This is why we ask you to come here, so that, because we are not in any way attempting to hide anything. And this is one of the first of monthly reports we will be given to the public about the situation of Zika. If we think it warrants a more timely report, then it would be reduced to every 2 weeks. The Chief Medical Officer, Dr. Shamdeo Prasad, will now give you more details about that last case.
Thank you, Minister. As Minister said, we 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 identified the second case. As you recall, the first case was identified in a female early in January. This is the second case, and this is a part of the continuing work. So surveillance activities of all persons who are suspected with Zika, which includes a combination of fever along with a rash and with conjunctivitis. Those samples, as Minister said, we had 88 persons who fell into the classification. Of course, you know, for testing, what we do is CARPHA recommends a serial testing where each such person is checked for dengue and chikungunya. If those are negative, those samples are sent on to CARPHA where the test for Zika is done. So far, 55 results were made available, and of those now 2 are positive. The newest case is a teenager from the East Bank area. The person has no history of any travel outside of Guyana. He did visit one of the hinterland regions more than a month prior to the occurrence of his symptoms. He started with fever and then came down with a rash and red-eye conjunctivitis. Investigation, of course, once we got the confirmation, was initiated. The premises were visited, and there are 4 members in the household. They were all interviewed. We are in the process of sampling and testing those persons to see any possible occurrence. We have commenced work in the area at the household level, spraying the home, instituting some bed net procedures to ensure that they are all using them. The patient himself has recovered following his treatment at the vector control services with some symptomatic medication, and he's back at school. We have been able to track all of his movements, including his attendance, his lessons, and so on, and we are following up with those sites to ensure that appropriate vector control measures are taking place. What we do usually, what we're emphasizing is first inspection of all the premises for possible breeding sites, including the black tanks and so on, advising the household how to, of course, treating those sites if we find breeding sites. They are using the Abbey treatment for all those when they see mosquito larvae around the household, treat those, and then teach the parents and the household members how to protect those sites by screening them and stuff. We are embarking more on this. We have several other measures for the integrated vector management besides fogging, which is part of the activity too. So the fogging exercise continues, especially in the areas where there's high mosquito index and where we have cases. But where the cases are, there's more intense activities in terms of doing house-to-house inspection and treatment of those. We are continuing to alert all of the health facilities. We have sent out over the weekend an additional reminder to all the health facilities to be on the lookout for cases. There are many conditions that causes a rash, and lots of the suspects that are identified in the both public and private sector sometimes don't have fever, or they might have rash that are associated with bites, with allergies and so on. So the doctors are looking at the rashes altogether to ascertain which ones really fit what we call the case definition for Zika. And that's what guides the collection of the samples and then for the testing. There are several reports of different types of rash, and we're looking at those now objectively to try to advise best on which of the rashes more highly suspicious of Zika, and to try to confirm those quickly with laboratory testing. Our turnaround time for testing has been within 7 days for most of the sample. Each batch of sample that goes to CARPHA, we would get the results very quickly, and we were able to confirm and take the necessary containment actions. At the borders, we know that the Brazilian situation continues to be very volatile, and we have some unvalidated reports that in Boavista there might have been some additional cases. So we did make contact with the authorities there, the health authorities, over the weekend, and they have been continuously fogging and monitoring the border traffic coming over, especially for persons who come to Lethem but also come down to Georgetown. There are two levels of screening that takes place. One for people coming to the border town and then returning back. And then if they're coming to Georgetown further on, there are additional requirements, including a thorough health check to ask about signs, symptoms, or contact. More importantly, contact with persons with these symptoms. Of course, you know, unfortunately, Zika is a relatively mild disease in most persons and can even present without any symptom. The infection can occur without any symptom. That's the worrying part of it. So there could be people who are relatively healthy who might be transmitting the virus. In terms of pregnant mothers, we've continued to distribute mosquito net free at all our antenatal clinics across the country, and I understand more than 5,000 nets have already been distributed. They are in the process of also providing education to all the pregnant mothers. Of course, the risk is more important during the early period of pregnancy, so we are encouraging again registration with your antenatal clinic early from the first missed period for the ladies. Please check with your local health facility so that they can give you the information and ensure that you are protecting yourself. I think that would have concluding my brief remarks on this. We will now open the floor, Minister, for some questions on both Ministers' initial presentation on the procurement system and Zika. Yes.
Tanika Percival Savages. Minister, you mentioned the bidding document. Is that document publicly available? Will we be able to source copies of that?
It's for sale, really, but we would want you to wait a little before you buy until we make that necessary correction. Those who have bought it before will make public the changes we've made in that document.
And they're by law, right?
Yeah, and
They're by law.
Okay. And in relation to the Zika situation, you said that you sent off 88 samples. Would you be able to tell us?
Well, 88 suspects were identified. We collected those and we did some local testing here for dengue, and then we screened, and 55 samples were actually sent.
Okay, 55 samples were
Yeah.
sent. Could you tell us, thinking of our geography, from where those samples were sent and whether they were all taken from public healthcare providers, or if there were some cases where private healthcare
Private
providers
and public,
referenced?
yes. And there were samples from all of the regions. We even had a few samples from some of the outlying regions too, through the Vector Control Service. But most of it was actually from regions 2, 3, 4, 5, 6, you know, along this main coastal areas. We did have a few samples from some of the outlying areas, and included both public and private hospitals and the Vector Control Services.
Kurt Cameron News Source. Dr. Tisol, could you be a little more precise and tell us the exact East Bank location from which the second victim was identified and the exact age of the individual?
Well, you know, I'm not sure that I want to do that. So we don't want to. Yeah, we know that.
Names. I just want to know the East Bank location.
Yeah, well, it's Eccles on the East Bank. Our first case was in Covent Garden, so that whole corridor now. We don't want to see it as just those communities. We want to see it as the entire corridor along there. Whatever it is, you know, we have to focus on that area. And he's 16 years old, a high school student. Yeah.
Pregnant mothers, what are the measures?
Yes, well, first of all, early registration with the health facilities to ensure that, you know, you get the correct information, that the pregnancy is confirmed. Once you've missed a period, there are several tests that could be done. You're registered with the clinic, there are certain procedures that need to go, and we would give a mosquito net to each one of those mothers at the time of registration or the attendance at the clinic. They will also be told about signs and symptoms to avoid persons who may have rashes with fever. You know, there are things that persons who are pregnant can do to avoid themselves becoming infected.
There were new way of transmission, which is what
Sexual, right? And that's also given, that information is also given to the pregnant mothers about barrier protection.
actually it was found in the semen.
In the semen.
Does not necessarily, it will not confirm that it's
Yeah.
transmitted by sex. As well as in the saliva as well.
Yeah. And there are two things, you know, sick people who are experiencing fever and rash and so on should probably not engage in sexual activity because there are multiple risks. You don't know what it is, right? There are other diseases too that are sexually transmitted, and so. Secondly, a question was raised about caring for persons who, like children, persons who have rash and so on, and we strongly advise against, you know, persons who may be sick taking care of other dependents in their household. And so even if it's a parent, sometimes you have to withdraw yourself a little bit, sleep under your net. We're saying the persons who have these symptoms, who's experienced a fever, should be the one under the net, so they don't, you know, of course, take the measures to control the mosquito around your home is very critical.
It should also be pointed out that while net is important, generally it's a day-biting mosquito,
day-bite.
and we tend to be
Yeah.
on the net only at nights.
Dr. Sean, here's what I'm thinking of. You said 5,000 the treated nets are going to be distributed across the
About,
country.
yeah.
Is that sufficient? I've been told that with one clinic on the
More
East
than
Bank, 10
Yeah.
nets were sent to that facility.
Right, right.
And that was totally demo.
Well, initially it was for pregnant mothers. We've expanded. We have about 16,000 pregnancies per year. So in any 1 month, I doubt whether we have 15,000 pregnant mothers come into clinic. Over time, I think this was an initial release. There are more that they are sending out. So we've expanded now, and the advice is for children under 5 to within the household. So some households are getting 2, 3, depending on the number of people. But you're right. Initially, it was only the number of pregnant mothers that the clinic had. So if they had 5 or 10 new pregnant mothers, they only got that number of nets. But we've corrected that since, and now they're providing enough nets. Of course, they have to be documented. We're asking them to sign for the nets so that, you know, of course, we can account for these appropriately, because we buy them.
Actually, they were being sold by unscrupulous persons in interior
Have the market, yeah.
locations.
I'm just trying to get clarity on the procurement of drugs. You said that the REO would send this sum to the ministry. What are the benefits of that? Having, if I'm getting it correctly, at the level of the region, you set aside a sum and then you send it back to the ministry for them to purchase the drugs? What are the benefits of that?
It's now all of the regions would not require the same medication and in the same quantity. So it is just a question of program budgeting for the health cost at the regional level. So, for instance, Region 8 would not require the same amount of allocation as, let's say, Region 10, and they might need a different amount of a particular medication. So this is what we hope to do by this. What has happened is when you go into the different regions, in each health center, each health hut, in the corner, you will see a bundle of expired drugs. Okay? In 2014, we had to destroy 280 million worth of expired medication. And this is what we're hoping that we would get rid of. Okay, that 280 million could have gone into the purchases of equipment or even building a health center. So we must be careful about what we have lost before. And you know, why we send it to the regional, to the Central Ministry of Public Health, is to have the benefits of what is referred to as the economics of scale. If you buy in that large quantity, then you get it at a less price and so on. Okay, so this is why we're doing one purchasing here at this level. But according to what they need, they send and ask us, and then they warrant the money down to us eventually.
And in this year's budget, I'm not sure or anything, but to fight Zika, is there a particular sum allocated to combat this Zika virus here, or no?
It falls under infectious disease, not specifically Zika virus. What I know is that we had some funding to do specifically the PR work.
right.
That is
She's
to
gonna-
send out information to the public, either in jingles, in brochures, in pamphlets, and on the television and everything. Even on the signboards that you see around Georgetown.
Yes, if there are no other questions, let me extend on behalf of the Ministry of Public Health thanks. We do look forward to engaging you very shortly. Thank you very much.